Perfect. Hello, everyone. Gabrielle here. If you didn't know, I'm the admin of this group, and I'm really excited to be doing this live today with one of our group members, Laura Kinney, who owns a super successful group practice, and she has multiple nurse practitioners and prescribers on board in her group. And I know that we have tons of questions about this. So she is here to answer them and to give some more insights on, what you should and shouldn't do or consider. So if you're watching the replay, as always, make sure you put hashtag replay so we can come back and see all of your questions and make sure that we get to them. And if you are watching live, I am keeping an eye on the chat. So if you've got questions, just put them in here and we will get to them. But let's just start. Laura, introduce yourself, tell us where your practice is and how you started.
Yeah, for sure. So, like she said, I'm Laura Kinney. I own a group practice in Omaha, Nebraska. I have had my group open for about 3 years now, or we're in year three. I was a solo practitioner, like a lot of us, for 10 years before that. So, a lot of what I'm going to talk about, I am drawing from not only my 10 years as a solo practitioner who did all my own billing, all my own marketing. I did it all, right? And so I had that knowledge before I started my group. When we get into like the billing side of things today, if we get into that, my group currently, I think we're at 23 or four therapists, and then we just are about to offer to our sixth nurse practitioner as of today, actually. So we have five, and a sixth coming on. They're not all full-time. We would be offering to our second full-timer here soon. The rest are part-time or kind of PRN. And we can talk through that as well, like the benefits and to hiring a mixture of part-time and full-time. I don't do that for therapists. I don't hire part-time therapists. But for the nurses, I actually have made that exception and it's been okay. So there's just some differences in that. But I'm trying to think if there's more I can answer about the group, but we're a pretty traditionally run outpatient group. We see all ages, so children through seniors, and our nurses as well. So like we do offer prescribing for children, teens, and adults. I think the only thing we really don't do is just like the more specialized geriatric care, because that is a little complex. Those folks tend to be on just a lot of different medications or have other health things going on that make that more of a specialized care. So for us, we don't really, we kind of stop at about 65 roughly. But we're fully insurance-based. I'll say that up front. We are fully insurance-based, including Medicaid, Medicare, TRICARE, you name it. And we are everybody at my clinic is a W-2 employee. So I will be speaking from that lens. Although we started, like it didn't last very long, I'll be honest. We switched pretty quick, but we did start with 1099 practitioners. So actually my first nurse practitioner hire did start as a part-time contracted staff member. So
I have a lot of questions.
yeah, oh, that's great. I love that. That's easy for me to answer that way because I have notes, but I would love to know if you probably know from your community what they want to know. So
Yeah, I think, well, and I also see that a lot of people are watching live. So if you have questions, make sure you put them in here so we can get them answered. But I think, how did you know that this was like the natural next step? Were a lot of your clients asking for that, or did you just see it as a business opportunity that your community needed more prescribers?
both. Actually, and Gabrielle and I were kind of talking about this in the waiting room when we were just, warming up a bit. But my background, even before I was a therapist, was I spent many years working in medical social work, in hospital social work. I'm an LCSW. I've always loved the medical side of things, like personally. So my years in hospitals did, full disclosure, gave me an advantage to being able to talk to nurses, nurse practitioners, PAs, MDs, because those are all different level of provider, both in the psychiatric side and just the medical side. Because for many years, I wasn't necessarily just doing biopsychosocial intervention, which is a big part of hospital social work and medical social work. I was also doing discharge planning because that's the other biggest role of a hospital social worker is you are planning for the discharge of these folks.
Mhm.
So you need to know psychopharmacology, you need to know pharmacology, you need to know the anatomy of a chart and what each, lab report means, what's a MAR, like a medication administration report. So we get all of this knowledge and you just absorb it on the job. Nobody teaches you. There's not really a class. So I learned from just some excellent social workers in the medical side, in hospitals, working trauma, working med surge, and some psychiatric to learn how to talk to medical, professionals. So that helped a lot. And then when I started the group, at the time I had a business partner and it was actually her suggestion. She was the one who came up with the idea, do we want to have a prescriber? I hadn't even considered it. But we did it and we got, that first nurse to give us a chance. Honestly, like she gave us a shot, even though knowing we had never employed a prescriber. And she was a very, very experienced nurse, like just like really many like decades of experience. So we really lucked out in the beginning recruiting her, and we learned a lot from her as well. And so anybody who hires on a nurse practitioner, I think just be willing to learn from them because, I'm sure if you're watching, you're probably a clinician, like a counselor or a social worker like me. And it does take a different skill set to employ prescribers. The other thing that in my state, in Nebraska, we are allowed to do that.
Mhm.
Not every state, so probably honestly, not everybody watching or will watch this has a state where you as a therapist, a master's level clinician can employ a prescriber. So you obviously want to start there. You got to start with your state laws. I don't know all of the states that allow it versus don't. I just know Nebraska does. We have pretty, I guess the word I'd use is flexible, or vague, I guess is the other word some people use, kind of restrictions in terms of like what it means when a nurse practitioner gets out of school. What does the consultation mean? What kind of supervision do they need? It's a lot different than therapists. Like, pretty much universally, when a therapist gets out of school, they're going to work under supervision for about 3,000 hours. Sometimes up to 4,000, about 2 years of full time. You're meeting with that therapist two times a week or something like that. That isn't the case in Nebraska for the nurses. When they get out of school, they just have to have someone available for the first 2,000 hours to consult with on their cases. They don't meet regularly necessarily. It's not a requirement. Now, whatever that supervisor or that consultant wants to do, I'm sure they could set their own parameters, but in terms of the state regulations, they're pretty open, I guess I would say here. The other thing is that in my state, and this is something you'll want to research, is can your nurse practitioners prescribe independent of a physician? That is not the case in every state. In Nebraska, it is. So they can prescribe, they have autonomy. That was something that I think was legislated quite some time ago. So they do not need a supervising physician to do their work outside of that initial, kind of graduation period. They also don't need to be supervised by an MD in that period. It can be another APRN with 5 years of experience in Nebraska. So start with your state laws. Start with if you can employ this person, because I know like Texas, you can't. I think Minnesota, you can't. So unfortunately, that might leave you without the ability to do this, or you may need to do it another way. I don't know the options. Check your state laws, check what happens, check what kind of supervision is required. And the best place to look for that is DHHS's website in your state, looking at the nursing regulations and just some light reading if you want to pour over the licensure regs for all of your staff members. But that's where
That
we started.
that's so helpful because I know in Florida it's like a what is it called? Like a collaborative or collaborator state. And so like the nurse practitioner, you do have to collaborate with like an MD to
Yeah.
supervise, and usually the practice pays for
Pays
that.
for that. Yeah, yeah. And that's not necessarily, it's not necessarily prohibitive. Even if you're in a state like that, and you can employ them, then you could work into your compensation model. It's another expense that you just have to kind of work into your practice and how that works. And if you can cover it for them, I'd say that's probably expected and typical. The things that we cover include things like their DEA license, which is how they can prescribe controlled medications. Sometimes we offer to help with the liability, even though we have our own, they have theirs. So there's ways that we've kind of worked those different costs into the compensation. But if you're in a state where you can't even employ them because you're not a nurse or you're not an MD, then that probably you'd have to have a business partner or somebody that is those things in order to employ them.
And we have a question from my friend Sam. She said, okay, so you mentioned you hire all your employees as W-2, obviously. When you hired an NP, did your current malpractice insurance accept the prescriber, or did you need a new policy specifically for prescribers? That's a good question.
That is a good question. So I go through, because I'm a social worker, I go through the NASW, the National Association of Social Workers. It's our professional org. I go through them, always have. So their risk retention group did accept the prescriber for me. And they ask you a whole set of questions about that. And then I actually had to provide a whole set of follow-up questions. And I will tell you, our liability went through the roof, kind of. Like we pay a lot in liability, but that's because taking on a prescriber, it really depends on your stomach for risk, because there just is a little bit higher risk anytime you get into the prescribing of medications. And for us, we're not even just doing medications. We offer long-acting injections, like all these different things that as you build a psychiatry program or are interested in that, there are just sub lines that you can kind of get into. And we've started with the long-acting injections, and just those type of things bring extra liability, bring extra risk. It's just kind of part of the gig. So yes, they did. My liability is fine. It covers all my W-2 employees, including my prescribers. My entire staff also has their own liability. Like we ask them to get their own liability, but we have worked into compensation, certain levels of our compensation, because we have different levels. We have managers, we have staff, we have directors. Some of them were helping reimburse for the liability. So you can work that in, but there's a lot of liability coverage at our on all sides. Yeah. But yes, they did. I had to provide a separate roster, and I had to get, they asked me a lot of specific questions about what type of things they're providing. But they came back with a quote and it was higher, but fine.
Yeah.
We expected that.
Yeah, that makes sense.
Yeah.
That was a really good question. Thanks, Sam. She said thank you. What was I gonna say? I was gonna ask about marketing because, and we were also talking a little bit about this beforehand too. I've heard both, but I've had some consulting clients who have hired a prescriber and gone through everything because they knew that there was a need, but they're having a really hard time filling that prescriber's caseload. So I just wondered, do a lot of the referrals come from the community? Are they mostly internal, which is nice because it's reciprocal that way? And,
Mhm.
what does filling their caseloads kind of look like? Because what they do is much different than a therapist who sees a client usually hourly, like every week to start off with, and prescribers don't work that way.
Yeah, they don't, and they're much higher volume in every way that you can imagine. Their caseloads are, I mean, more than quintuple really what a therapist would be, who's maybe maintaining 25 or 30 people at a time, and I mean, our prescribers have hundreds of open files at a time, because you can. And really, number of active files is not a great way to track that, because you could have somebody who's coming in every 90 days or every 6 months. And so that one open file is not what it is for a therapist. So you have to have different metrics for sure. The way we've done it is we moved to the 2 patients an hour. We used to do 3, which is like a 20-minute office visit, and we moved to the longer office visits per hour so that they were seeing fewer per hour. So now they see 2, they do 2 med checks. And then full intakes are just like a therapy one, it's a full hour. So we kind of go by units. And so those hours need to be filled, and whether it's with 2 med checks or 1 intake, that's your unit, and it's filled up. In terms of marketing for them, yes, tons of it's internal, and we have a large therapy staff. So Absolutely, if it's appropriate for us and it's not like a super specialized need like perinatal or something like that, then they are referring internally for meds. And people love that one-stop shop. They really do. And they know that there's that collaboration between their therapist and their nurse. Um, so I think that I approached that the way I did with therapists. Once our one nurse was getting quite full, and like I said in the beginning, she was part-time. She wasn't necessarily depending on us solely for her income. So that slower build for her was okay while we got to know what was needed. But I think I approach it the way I do with any type of marketing and caseload filling, which is, I know Gabrielle talks a lot about relationships. You have to have those. You have to have like people that are referring to you in general, and then they find out you have a nurse. And I had to do a lot of going right to therapists I knew, like, hey, who are you sending people to for meds for these type of things? We'd love to be added to your list, and getting those flyers out there. It was a lot of like just going to the people that I personally knew, and I was doing all of it myself. Once you kind of build that up, we have found the momentum has taken off, and now it's more of just like our general marketing approaches. How are we showing up online? How are we showing up? How do people know we have this? When you search, psychiatric meds near me, like, are we coming up? And so we have really kind of shifted more to just like getting that larger market share and getting in front of the people that are looking for this. The other thing is, yeah, just kind of knowing your practitioners out in the community who aren't already, if they have a nurse in their office, don't bark up that tree, right? They're not referring to you, right? But if, go to the places that have a group of 4 or 6 or 10 therapists and they don't have a nurse on staff, and they would love to have a place that they trust. And honestly, I've found a lot of trust for people who know me as a therapist and know that I'm the owner of the company and can talk to me and access me and learn about the nurses from me. So it was a lot of like getting in front of people and messaging them in the therapist groups I'm a part of in my community. Mm-hmm. And then it seems to me now that it is a lot of just people finding our site and calling us and seeing what we have. So I think we've pivoted to needing to do as much of those direct reach outs. We're kind of at that phase where we have a lot of just a really good incoming stream.
Yeah, which is amazing. I mean, obviously, if you're about to hire your sixth.
Yeah, sixth, right.
What considerations might be helpful for people to know with insurance and billing? And like, I mean, obviously that's a very complex, nuanced question, but like generally, I mean, it looks different. Did you have to change your taxonomy code? Did you have to change anything with your contracts?
No, we just had to add them to our contracts under, their taxonomy. So they were just added to our group contracts as anyone is. Just under their license, under the fact that they're a prescribing, they have prescriptive authority, and that's what you're going to get. And if you have insurance contracts, if that's what you're already doing, you already have fee schedules. And if you get online and look up the CPT codes, you can already find out what they're going to be reimbursed because it'll be on there because they usually give you the gamut, right? They give you everything. And, a lot of us who do our own billing and I always recommend, I say this to everyone who's thinking of going on their own or even starting to hire is even if you do end up hiring out your billing and maybe you need to because it's a lot. And especially for me, like at this volume, I could never keep up. Know the billing, like get to know the billing, like do some of your own billing for a while, maybe just to like know what I'm talking about. And I think you are just way better prepared as you go on to hire and understanding CPT codes, understanding add-ons, and you just start kind of researching what they can do and what are the office visits basically for a nurse. Mm-hmm. I actually had a nurse practitioner friend in town who he said, these are the office visit codes. And I said, oh, and so then I just looked those up and that was it. And then I figured out, some are time bound and some are like kind of clinical decision making, like moderate intensity, severe intensity. There's a little bit of a learning curve with the billing, but if you've done your own billing, it's not going to be too crazy, as well as if you're hiring out your bill, if you have a biller and they're a strong coder, they're probably going to have access to knowing how to do the coding on this and really maximize your revenue. So for us, like I said, we decided what was best for everybody in terms of reimbursement, in terms of just time spent, was to do 2 visits an hour. Some places are doing a lot more than that, and they have their reasons. But you would want to look at your data, look at your contracts, get your reimbursement, and figure out, well, what's it going to be an hour if I do this? What's it going to be if I do this? But that with group practice ownership, you're doing that. Ideally, you're doing that anyway, figuring out what is your hour, what are you getting for your full hour in your region.
Yeah.
So yeah.
Um, that's super helpful too.
Yeah.
And Sam is also asking if you're okay sharing, like what EHR you use, because she uses Simple Practice, and you can't use Simple Practice. Well, you could, but you need
Yeah.
something else.
Yeah, no,
You
simple
can't
practice
prescribe.
doesn't have e-prescribing, I don't think, does it? It doesn't, is what I heard. Yeah. So, well, we are making a change. We are currently using Therapy Notes. They have an e-prescribe feature. For us at the volume we're at, and especially the lack of secondary, they don't bill secondary through that. I do have an in-house biller, which is wonderful at this stage of growth. It's just becoming a little cumbersome for us. And the e-prescribe on Therapy Notes is okay. Like the nurse's feedback is it's okay. It's not wonderful and it's not terrible. It's okay. So for us, we are making a change. But I don't know for sure. We're down to 2 that have e-prescribe. But yeah, I mean, if you do something separate, what I've heard good things about, I do have a friend out in Iowa who they use Therapy Notes for their practice for their therapists, and then they use MD Toolbox on the side. So if you need to do like an add-on and you don't have the option with Simple Practice, or you don't want to use e-prescribe and Therapy Notes, I've heard good things about MD Toolbox. I don't have any personal experience with it because we've always done it integrated. For us, the collaboration piece is pretty important, being able for everyone to see the same notes.
Yeah.
If you use a separate system, you're not really able to just pull up somebody's psych note or vice versa. So for us, that was a little prohibitive, but
Yeah, she mentioned MD Toolbox, and I know a couple other people, or ones that I've looked at when I was doing some other consulting, was Valent and
yeah,
say Healthy is what the other one was called, which I hadn't heard of as much. It's more for like PTs and OTs, but you
yeah,
can use it for therapy also, but the platform is just a little bit different.
yeah. Yeah,
Um,
Valent is actually one of the ones we're one of the top 2. The other one we're looking at is called Therapy IQ, and they offer an e-prescribe feature. They're more of a startup, so they don't have as much buzz, I think, but Valent has been around a long time.
Yeah, they have been. And I've done some demos with them too, and they have a lot of cool features. It's definitely more expensive, but you know.
Yes, that's a pricey one, but by the time you have more, if you think of hiring one, you really have to think of if you're going to hire more. And I honestly could have never really dreamed we'd be at this point with this many, but it's, they're great. Like they're just they're a fantastic part of the team, and everybody really likes having that collaboration on both sides. And they really like having therapists down the hall to say, we've kind of maxed out options on medications, or we're doing this, but you need this. And so I think it increases that, not only that compliance, but just that collaborative multidisciplinary team has been so cool to develop.
Yeah,
Yeah.
that's amazing.
Yeah.
Well, I mean, we've been on for almost 30 minutes, so I don't want to
Yeah.
take up too much of your time, but do you
Okay.
have any like lasting things that you would tell somebody who's considering this? And then also tell people I don't know if you do consulting, but if you do, tell them where they can find you.
Not in any like real official. I have done some, but I don't have like a business around it because I'm just so like I'm the CEO of this place, and so I do it.
Yes.
Yes, I can talk with people. I'd be happy if you want to reach out or PM me. If there's like specifics you want to talk through, I'm good at that. Just kind of like if you know what you're coming in with and how you want to problem solve, I'm pretty good at that, and I've done that locally for sure. So I would say the other things you'll want to do, I would always recommend this. And if you don't have experience in the medical side of the field, like, because medical social work or any type of, I guess medical social work is kind of it. But if you don't have any experience with that, you can still learn psychopharmacology on your own. You can still go and take classes on that. And I would get to know those classes of drugs. I would definitely know about controlled prescribing and the laws and the prescription drug monitoring program called PDMP. I would be able to speak intelligently about those things and learn them. And ask your nurses, or if you do get one hired on, let them know that you're willing to learn from them. And you're admitting I'm not, I'm not a prescriber, I'm not a nurse. And so letting them kind of help you learn the certain things that you need to do, and knowing that you will do that as you go. There just isn't a class out there for therapists and how to employ, prescribers, other than going to nursing school. But so that I would say, familiarize yourself with that, as well as what are controlled substances, and is your nurse going to be prescribing them, or are they not going to? And really good policies, around what to do if somebody, is getting a prescription filled at multiple places, what to do for coverage and call and things like that. What happens if your nurse is going to be gone for vacation? What kind of coverage will there be? Those are all things that we've just kind of like, oh, like we've figured that out as we've gone. But you could definitely save yourself time if you if you did a little bit of that up front. But for us, that it's kind of just the same philosophy as running the entire practice. It's good policies, it's good SOPs, standard operating procedures, regular meeting. I have a monthly meeting with each department. So the medical team meets once a month with me and our operations director. We do it virtual so they can come from wherever. Have those meetings, touch base with them, find out what's working, know what supplies you're going to need. Are they going to work virtual? There's a million things I think I could say, but it's not too far off. If you've built a group or you've hired a few therapists, like it's not that far off. It's just there's this extra kind of layer of the medical side that I do think you can learn. If you're willing to just put in some time, and maybe even shadowing, like if somebody would let you shadow a day, like of a psychiatric nurse practitioner, and really learning that. The other thing we've had to really contend with now that we have so many nurses is that we are on the radar of every vendor and every rep. And so we have my therapists are just like, look at all this food, because I always insist that they bring enough for the whole practice. I don't let them just kind of bring food for the nurses, and they're always happy, they're happy to do that. We have some really great relationships, I think, with the reps that come through, and they're very kind. And of course, but so they bring a lot of food, and they bring a lot of stuff to get to in front of the nurses and talk about whatever drug they represent. And I think knowing how to handle that, and knowing how to schedule that, and really training your administrative side on getting them in the door. And how are you? We always invite our therapists even to come to those prescription drug presentations to understand the pharmacology side as well. So we make it a whole practice event, and those type of things to try to get everybody involved. But that's been one of our newest things, is we have just like tons of visits now. So
That's fun though.
yeah.
I worked in a doctor's office for a little bit, and I would see their patients for therapy. And I loved that because I was always there on Wednesdays, and Wednesdays was the day that the reps came in, and I was like, I get free lunch today.
Donuts, there's coffee, there's lunch. You name it. And so yeah, we really enjoy that. And we encourage everyone's participation, and just to kind of, yeah, I think just knowing how do you want the day to flow? Are they going to be full time? How are they going to spend their time? Are they going to be in office certain days? But that just goes back to your whole, that's operations of your whole practice, and they're a part of that. But
Cool. This was amazing. This was so informative. I personally just learned a ton from listening to you. So
yay.
I really appreciate that.
Yeah.
And I appreciate too, Laura always puts really thoughtful responses in the group as well. And so I think that's really helpful, and I appreciate it. So
Anytime.
if you have questions for her, you want to learn more about this, she's attached to this live, but I'll tag her below also, and you can just message her. And if you're watching the replay, just put hashtag replay, because that will notify us and we can come back and answer your questions. Or, as always, just make a post in the group and we will get to it that way as well. So I appreciate you all being here. The replay is, and this one and all the others, I've done a ton of live videos on tons of different stuff that is really helpful. And you can always just listen to these in the background while you're doing your notes or whatever. They are under the media tab on the main page of the group, and you just go to videos and you can watch all of them. But thank you again for spending the time, Laura. I really appreciate you sharing all your knowledge.
I loved coming. Thank you for inviting me, and hope everyone has a good day.
Thanks. Take care.
Bye.